Our next witness is Ms. J.
That's correct, sir.
In her case, as I mentioned this morning, as in the case of Mr. I, there will not be any live streaming which will show her as she gives evidence. She's giving evidence anonymously, so the same ruling applies in her case as did in Mr. I's, and you'll forgive me, I hope, for reading it through so that everyone can hear it again as I have to do. It is ordered that the name and address of witness W0481, that's Ms. J to you and me, and any other identifying information, such as the witness's image or a description of their appearance, cannot be disclosed or published in any form unless express permission is given by me or by the solicitor to the inquiry acting on my behalf. Witness W0481 must be referred to only as Ms. J. This order remains in force for the duration of the inquiry and at all times thereafter, unless otherwise ordered, and I have the power to vary or revoke that order by making a further order during the course of the inquiry. It is so ordered. Ms. J.
Your name is known to the inquiry, but you'll be known as Ms. J today. Please take the book in your raised hand and repeat after me. I swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
Nothing but the truth.
Ms. J, you are a symptomatic carrier of haemophilia B. Can you tell us what that means?
It means that I would be known as a carrier of haemophilia. I wouldn't be made out to have full-blown haemophilia, be mild haemophilia, but over the years I have had several serious hemorrhages and required a lot of treatment before and after procedures.
You've had 5 major hemorrhages in your life. What can you tell us about them? Or would you prefer me to set them out?
Well, most of them I do remember quite clearly. The first one really being when I was about 11 years of age, getting my appendix out. And I took a hemorrhage after that and I needed a large blood transfusion.
That was about 1969.
1969. And then following that, I had quite a serious bleed after getting some teeth out. And a few other times it mostly been due to dental work. And even when I'd been in my early 20s, I had further teeth out and I wasn't long married and I had quite a major bleed even then. At that time I was identified as a bleeder, but I'd never been identified as a haemophiliac or a carrier of anything, and then there was further investigations done and then I was told that's what it was. And then following that I've had further teeth, but after I had my daughter was born, I had another very major hemorrhage.
About 1984.
Yeah. And I know at that time I had needed a very large blood transfusion, plus been cryoprecipitate and stuff at the time, but in between times I'd had, then I had a hysterectomy and I had a major hemorrhage following that as well.
And you'd also, your second daughter was born in 1988.
Yeah.
And you'd also been given cryoprecipitate then to prevent any hemorrhage.
Yeah.
You were also given factor 9 throughout whenever you had particular surgeries, as well as cryoprecipitate.
At different times I would have been given either factor or it would have been bloods or cyclocapron. It just depended on what procedure I was getting, and to be truthful, sometimes I was not fully aware of exactly what I was being given at the particular time. You just knew you went up to have pre or post treatment.
All of that treatment was, or the majority of your treatment was here in Belfast,
Yes.
but you weren't invited to attend the meeting in 1984 about infections that we heard about earlier this morning.
This morning was actually the first time I'd ever heard of any meeting, even ever having taken place.
And that troubled you?
Yes, because at the time I was never told, probably until the early 90s, that I was infected, but it's obvious now to me that in 1985 it was known that I was an affected person and I should have been included in that meeting.
You recall that at some point in the 1990s you were told that the hospitals were changing their blood supplies. What can you remember of that?
What I do remember was it was a short time after I'd actually been told I had hepatitis C. And I was still actually trying to come to terms with actually having the diagnosis, which it's in my statement that I had been told when I had been attending a clinic and asked how I was coping with my hepatitis. It was following this, it was part of a conversation in a consultation a lot of weeks or months later. I asked about how the infection had taken place, and I'd been told at that time that unfortunately some of the products had been brought in from America, and it's now public knowledge that some of them had been the products had actually been bought and used, and I was reassured that that wasn't going to happen again, and that they were actually looking into buying products from a Parisian company so that would eradicate any further infections taking place.
We've talked about the sort of 5 major hemorrhages you've had and the dental treatment that you've had. You know that obviously at some point you were infected with a hepatitis C, but you aren't sure when that occurred.
To this day, I don't know. I was never actually told how, when, or where. I was just told you have it.
And how do you feel about that?
I feel very let down. Let down is actually quite an easy word to say, but I feel that I was just part of a statistic. I think people forget when they're making diagnoses of things, or if they're aware of people have a condition, that they're actually dealing with a human being. They don't realise the impact of a diagnosis has on anyone. I think once people were made aware, I'm talking about government and medical teams were aware, I think anybody who was at risk should have been informed immediately, not years later.
What you've said in your statement is what I don't understand is that the hospitals knew which blood products had been given to which patients, so why didn't they know that I was infected earlier? Didn't they use the batch numbers to work out who was given infected blood? I find it frustrating that I don't know when I was infected.
Exactly, because every unit of blood that is given to anyone, any treatment, there is a label comes attached to everything, so there should be a follow-up. And once a batch has been identified as being contaminated, then they should be able to recall exactly who's been given what contaminated blood.
You've referred to it a little bit already, but how did you then find out that you had hepatitis C?
I was attending the haemophilia centre, at that time was based in the Royal, for a routine checkup. And I went in for my usual checkup, and in the middle of it, I was asked, how are you coping with your hepatitis C? Well, truthfully, at that stage, I nearly fell off the seat. There and then, I just thought I'd been handed a death sentence. I was imagining nearly I was going to walk out the door and never come back in again. My head was just, my whole world just collapsed. Fortunately, my husband actually was with me that day. We walked out onto the corridor. He knew there was something wrong because I had went in myself. And I explained to him, we turned and actually came back in again. And that day, it was a registrar I spoke to, and I asked to speak to the consultant that day in the middle of the clinic, but unfortunately, it was a busy clinic. Feeling dismissed sounds wrong, but I felt partly dismissed. I was told, oh yes. I was handed a leaflet more or less and told, it'll all be sorted out, don't worry, there will be treatments. But I just felt there wasn't a support network even opened up to me at that time. You were just left to your own. So I walked out of that place absolutely devastated. My world had just collapsed.
Immediately, were you ever told you were being tested for hepatitis C
No,
prior to that appointment?
no,
And you were a nurse at that time.
yeah.
Was hepatitis C ever raised in connection with your work?
No, most nursing professionals would have had a vaccine for hepatitis B in part of their medicals, but it was never, my knowledge of hepatitis C was very limited until I ended up being told I had it myself.
And you were in quite a state for a few weeks after your diagnosis.
I think I felt as if I was in a parallel universe, and that might sound ridiculous, but the world was going on without me. I became probably more insular in myself. I would hold things quite a bit to myself, and I found even I became more insular. I was frightened who I could talk to, who I could share things with. I became absolutely paranoid around my children. I worried about if I was going to infect my children, how I was going to would I live to see them growing up? Would I see the next month, the next year? The unknowns were, I think you just go into an absolute mental turmoil because it's just the unknown entity of what's in front of you.
You've described that you were scared to touch your children.
Yeah.
You were anxious when it came to hugging them.
Yeah.
And you'd be frantic if one of the children used your toothbrush or touched a drinking glass that you'd used.
Yes, and it was very hard to explain to a young family why you were doing that, and to this day, it's quite emotional thinking about it, that you lost that personal touch that you should be able to just automatically go up and hug your children, and it's just that fear. They're too young at that time to understand why. I feel probably long term that fortunately my relationship is very good with my children, but when I look back now, I realise that they didn't get that probably warmth that they should have got from me at the time.
It also impacted on your marriage.
Yeah.
Can you tell us how?
Well, fortunately, I have a very good husband. But to say our intimate relationships would have been out the window. put it that way. And that's the easiest expression I can use, because I was scared of affecting him. Even trying to even share my affections with him, I was finding it even hard, because part of me was still in a mental turmoil most of the time. But fortunately, we have battled our way through it together, and I'm very, very thankful for that. But when I realise it's a journey that we both have unfortunately had to go on, which a lot of other marriages probably wouldn't have held together on.
It was both, you've said in your statement, the fear of infecting him, but also because you were becoming more insular, as you described earlier.
Because it's like everyone who has an infection, an illness or anything, it's actually quite hard to share your own intimate feelings about it. Also, sometimes you're actually scared to actually share them, because you don't want someone thinking little of you, even though it is your husband, partner, brother, sister, whoever it is. But I think it just seriously affects your relationships with other people, because truthfully, you actually can't be yourself. You are yourself, but you're living an unknown, and you're walking, should I say, an unknown path. And I think you're scared to actually probably let your whole true feelings come out. And I think then that's what affects your relationships.
You only told members of your close family about the hepatitis C.
Yes.
Why was that?
Well, truthfully, the stigma was the main thing, because people's perception, and even today it's still the same, as that hepatitis. I heard someone else speak about it earlier. I was waiting on someone thinking I'd been standing mainlining up the street, and it's the perceptions that people have of it. It's a hard thing to actually share with anybody else outside your own family, and I think you have to feel very secure in that. And but the main thing really is other people's perceptions of the disease. I shared it with my immediate family. My colleagues I worked with for a long time were aware I had haemophilia, but they never knew I had hepatitis.
And that meant you've said, like you were living a double life.
Exactly, because I had a work life hat and I had a home life hat. And that probably affected a lot of relationships with people I worked with, because they only actually saw part of me, and probably it's like everyone wears a mask. I probably had my mask on in my working life, and I could only pull my mask off when I come home.
Now, you were working in the hospital where you also received treatment.
Yes.
And what was that like?
It was actually quite difficult, but I was fortunate that the colleagues that I worked with in the area that I had the treatment in, I had the respect of them even as a person, and I trusted in their confidentiality, because I was fully aware that they were reading my notes, giving me treatment. And it's quite intimidating. I know it's intimidating for any patient to go and have treatment, but it's quite hard for a colleague, colleague sitting reading your notes and knowing your intimate details about your life.
You've described one occasion when you went in for surgery and knew the surgeon.
Yes.
And you found that difficult.
I found it difficult, but because of his professionalism, I have to say, and he reassured me that at the time that my diagnosis to him had no impact on his treatment to me, and that reassured me very much so. I think a lot of times it's down to individuals' response to you, and his reassurance actually, I think, got me through that particular journey.
Unfortunately, that wasn't the case every time, and you've described in your statement one particular occasion when you had a shoulder injection.
That day, I can recall very clearly, and I'm not being derogatory to people with this condition, but I actually felt like a leper sitting there. I went in to get my shoulder injection. The surgeon arrived to give it to me, and he was in a discussion with me, and all of a sudden the nurse that was in the room realised that I had hepatitis. Well, the next thing, truthfully, she nearly went off the wall. Oh, you know, you can imagine the whole hullabaloo. Oh, such an infection risk, and you're going to contaminate everybody else, and what are we going to do with all this equipment once we're finished? And I'm sitting there with a painful shoulder, about to get steroids put in, thinking, oh my God. And I actually turned around and said, if you follow the correct infection control procedures, I'm no more at risk than anybody else sitting here or anybody that's walked off the street. Unfortunately, the consultant spoke up as well, and I did get the procedure done, but I never seen antics like it, people running about putting gloves on here, there and everywhere, and you just felt like, and truthfully, I was so disgusted when I actually came out of it. I was very sore after getting the treatment and everything done. It was on the Belfast City Hospital site at the time, and I walked from there straight over into the haemophilia centre and asked to speak to somebody, because I said, if I have been treated like that, someone else is going to be. And I said, well, look, someone here, will they make sure they speak to the infection control people in this area so that this doesn't happen to anybody else again?
You had another occasion when you needed a gastroscopy, and you faced difficulties then as well.
I had, unfortunately, was diagnosed with a tumour in my stomach, and I had to have a few gastroscopes done, and especially on one occasion I went in and there's quite a discussion around what part of the list I would go on to start off with. I thought, well, fair enough. Then it was, oh, how are we going to disinfect this equipment? I could hear all this conversation going on as if I wasn't even in the room. And it was, oh, well, maybe we could use an old scope. I was slowly but surely sinking further into the floor, because I thought, here I am sitting here with a mange, never mind a stomach tumour. And then the discussion was also made that, well, if we can't use old equipment, then we'll maybe have to destroy the rest. And I was sitting thinking, heavens above, there's tens of thousands of pounds of equipment going to be absolutely scrapped just because it's been down my throat. I heard actually a similar comment made earlier, so it seems to be a common theme that eventually I did get the procedure done, and I had a surgery for my tumour, which fortunately was removed, but it resulted in me being in hospital for 9 days. And if I hadn't had the scope done, put it this way, my diagnosis wouldn't have been done, and I wouldn't have been sitting here today. But it's just the fact, again, that I was such an infection risk. And again, what were they going to dump the equipment out after they'd used it on me, which I think is deplorable.
And in your statement, you said that as a nurse yourself for so long, you feel that the perception of hepatitis C among healthcare professionals was atrocious.
As I said, Truthfully, I do, because I think that people's knowledge, I have to say initially myself, before I had my diagnosis, I had limited knowledge of it. But because there's been more in the last 20 years, I think all across the board of medical professionals really need to be re-educated in what hepatitis is, about the infection risks of it, and actually be up to date with the knowledge of it, but actually remember to treat patients as human beings. They're not just a factory line coming in. I would always like to have thought that people I looked after, you had compassion for, but not always did I find that. And I think it's very important that people are more aware of what the infection, no matter what infection it is, that patients are treated appropriately.
You underwent a first course of treatment in about 1999 or 2000,
Yeah.
and that was with interferon.
Mm-hmm.
How did you fare with that?
When I started the first course of treatment, I really went into it blind, in the sense that I wasn't fully aware of what side effects actually was going to impact on me. I knew it was a treatment that I was hoping it would clear the virus, but I wasn't expecting to end up with constant nausea. The fatigue was unreal, and the lethargy you had, and then even the impact of actually having to self-administer your own treatment at home. And again, the paranoia even came in at home with that, because all of a sudden again I was having syringes and needles present in my home with young children, and again the infection risk against my children came back in again, because I realised that there was treatment there. But unfortunately, despite going through the whole treatment, I was still positive at the end of it.
Initially, your viral load dropped, but by the end, it was obvious that it hadn't been successful.
I think, I can't be 100% accurate, but I know at some stage I produced a couple of false negatives in my viral load, and then I was told that I would need to go on the different type of interferon, which was the pegylated one at the time, but unfortunately it wasn't available here.
Why was that? What are your feelings about that?
Well, to my knowledge, what I was told was it was available in other parts of UK, but it hadn't been cleared by NICE guidelines to be given here, and that also that with different health regions there was different funding, and that I would have to wait a wee while. I can't remember exactly how long I waited between one treatment and the other, but eventually I was told that the second type of treatment was available for me.
You think it was about 18 months later that you were able to start the second treatment? At least that's your
I can't
estimate in
remember,
your statement.
truthfully, exactly the time zone, because a lot of it, truthfully, I've tried to black out. But it was at least a year nearly in between it, and if my medical notes were in front of me, I could probably find it very clearly, but I know that there was a good gap in between the two treatments.
And once you started the second round of treatment, what were the side effects that you faced?
I thought the side effects from the first type of interferon were bad, but I didn't realise how I was going to be affected further, because unfortunately even I felt as if I was going through a chemotherapy regime because I was absolutely and utterly exhausted all the time. I would be nauseous. I ended up actually starting to get quite paranoid. The impact of it was actually 10 times worse than the first one. I became clinically depressed, and I've never been depressed ever in my life. I became even further insular. My whole life completely changed again. And on one of the consultations when I was up at the hospital, the registrar spoke to me and persuaded me to actually go on to antidepressants so that I actually thought of stopping the treatment because the impact on me was so much. And she said to me at the time, it's important for you to try and continue, and persuaded me actually to go on antidepressants so I could actually finish the rest of the course.
Around that time, you were studying for a further qualification, and you couldn't complete that.
No, I had actually registered with university because of part of everyone's life you want to keep upgrading your certificates and stuff, and I had actually completed a certificate in health and social services management, and I was going on to do the diploma, and I'd actually started the first couple of weeks of it. But this was when I was doing my second lot of treatment, and it got to the stage of fatigue and the running back and forth to hospital. Even I just knew that I wasn't even going to make it, and I had to pull out of the course. And that was devastating to me because I had built my way up to actually getting to further advance myself, so that was a big loss for me.
And you struggled to be in work during the treatment?
I would have finished my work, come home, injected myself, and truthfully lay and perspired, is the delicate way of putting it, all night. Took 2 paracetamol, and then had to get up maybe at 6 o'clock in the morning to go back to work. In hindsight, looking back, I actually don't know how I kept myself going, but I had 2 young children. I had a husband who had actually just started a degree course himself, so I was the main earner at home. So I don't know, I had to push it from my feet and try and keep going.
And when you did need to phone in sick, you said you couldn't tell your colleagues what was wrong.
I think I must have had more flu than anybody else has ever had. But truthfully, it wasn't a lie in the sense that I was having constant flu symptoms anyway. So, I mean, it wasn't a lie, because the symptoms that you get from your treatment is headaches, shivers, nausea, vomiting, and that was the simplest answer. It was to phone in and say I had the flu.
That second treatment cleared the virus?
As far as I'm concerned, I'm clear, but I don't know whether I'll be clear forever. I've come up with a negative result, but I can never honestly say that I'm 100% clear.
You've had a number of scans and you don't have cirrhosis of the liver, but since the treatment you've continued to feel really quite unwell. Can you tell us how you felt?
As the years have gone on, I would have a general fatigue all the time. I would be a lot easier tired than I really should be. Part of it I would have put down a few years ago to, at my age, the menopause or something. but I know it wasn't because the symptoms kept repeating themselves. My even my memory probably wouldn't be as sharp as it would have been. And I'd be more susceptible to infections, colds and flus. And I found even recovery time from a lot of the surgeries I've had is a lot slower than a regular person should expect.
And as you've said, in 2015, you had a gastrointestinal stromal tumour removed.
Yeah.
And you've had 5 attacks of Bell's palsy.
I've had 5 attacks of Bell's palsy. I feel a lot of that, I think my immune system is weakened from the hepatitis C, but also from the treatment that I was given for hepatitis, because I feel really that it was nearly like a double course of chemotherapy, which in long term I feel has affected my immune system. And I feel I've been more susceptible, and unfortunately I feel it's just been like a catalogue of illnesses have occurred more so since then.
And you ultimately took early retirement at 59.
Yeah.
Why was that?
Well, to be truthful, over the last 4 or 5 years prior to that, because of the multiple times that, as you have said there, that I have had palsy, I had the tumour, I was finding that actually when I went back to work, I was finding that the fatigue, the tiredness, and the multiple times I was having to attend clinics, and I was just truthfully finding that I couldn't physically carry on.
You said you'd finish a 12-hour shift and would be flat out asleep until dinner time the next day.
If I worked a weekend shift, my family all knew that they needn't even dream of phoning me to 4 o'clock even the next day, because I would have been absolutely physically exhausted. I know people can be exhausted doing shifts, but I found that it really had got too much.
And you'd worked shifts all your life, so
Yep.
you were used to how that felt.
Yeah.
But this felt very different.
I would say truthfully, over the latter part of, but then I'm only talking about maybe 5 years post-treatment, after the second lot of treatment, then I would find more and more symptoms actually were getting worse. What you'd have put down to general tiredness was turning into exhaustion.
Do you now have any follow-up with the liver clinic?
I haven't heard a word from the liver clinic now for several years. One minute I was attending quite regularly, having bloods done, I'd had a few scans done, and then all of a sudden, no further appointments. So I don't know whether I will have a further review. I had always taken it, even that if I was clear, that because of my history that I would have been seen even every couple of years. But I feel like one of those people that's sort of, well, oh no, you're okay, and you've been pushed to one side now. So.
And the question that you say you've been left with is about the impact of the hepatitis C on your future health and things going forward.
Exactly, that's what I've been saying there. Is I've noticed as the years have gone on that my health is further deteriorating, and I seem to be more open to things. I do wonder, I never had stomach issues most of my life, and then all of a sudden a few years ago this tumour has come out from nowhere, and most people that would get Bell's palsy maybe would get it once or twice and would recover, where mine has never recovered, and I've been left permanently with disability, and I just still think that's been an impact of the disease on me.
You spoke earlier about being diagnosed with clinical depression during the treatment and being offered antidepressants and taking them. But were you ever offered any counselling or psychological support?
No. The only support I ever had was at one stage when I was attending for treatment, I was told that I'm nearly sure it was the Red Cross was available for a massage. And I got 2 massages because they were attached to the cancer centre. And that was the counselling and the psychological support I got.
Do you think if you'd been offered counselling or psychological support, you would have taken it up?
Most definitely, because I think it's a very lonely journey to making your own, and I think if you've always someone, family's important, paramount, but I also think it's important if someone else can be actually there, that can be an ear to lean on. I think that would have actually made a lot of people's journey right through this whole thing an awful lot easier.
You also received a letter about VCJD in the mid-1990s. What can you tell us about that?
That was like another, you thought, truthfully, it dropped through the door, I opened it, and I sort of put it back in the envelope and sort of then reopened it again, and my first reaction was, what next? Because I just thought, you can't actually tell me anymore because... But when you tried to talk about it, I felt it was sort of brushed to one side. It was just either part of being haemophiliac or part of anybody who's had blood transfusion. Even to this day, I don't actually think there was actually very much. The letters were put out, but there wasn't actually much follow-up after it. Most of what was said to you was, well, we had to put those out. Don't worry about it, and it might, it was. I felt the whole thing was actually played down.
And you've said you're left trying to just blank that out.
I think so. I think that's probably been my own coping mechanism. Is that you mentally can only take so much on board, but it's always back there. But I think the like of this inquiry has made me probably bring forward things that I have buried in my mind for quite a while, and it's probably good that I'm actually able to sit here and actually bring them out now.
I want to move on to the Skipton Fund. You've received payments from them, and you remember signing a form before you received the payments. What did that form say, as far as you remember?
It was such a long time ago, but from what I do remember was if you signed it, you agreed that whatever the outcome of the payment was, that was the totality of it, and that you wouldn't have been eligible to make a further claim into it.
The payments you receive have shifted over to the Northern Ireland scheme.
Yeah.
Do you have any particular points you want to raise about the processes?
The only thing I do want to say, yes, I feel it's good that it's been recognised that people need help with benefits or whatever, but I feel that I heard someone else also mention it. There shouldn't be any difference made from Tier 1 to Tier 4 in the payments of the benefits. I feel that everyone who's been affected by hepatitis C, HIV, regardless, should all be treated exactly the same. And also, again, that it shouldn't affect people's general benefits, because it is, if it's given to people, it's counted as their income, and then again it'll stop people actually getting some general benefits, which unfortunately some people, because of their disability or because of their infection, has had to leave their employment or whatever. People need support, not things pulled away from them.
You've also said that it would have helped if you'd had access to discretionary payments when you were ill,
Yeah.
because that would have put less pressure on you to keep working when perhaps you were too ill to.
I didn't know about a lot of this stuff. The longer it has went on and you find out about things, they're not actually have been put to the forefront. I don't think even amongst sufferers of the disease or the infection, should I say, were actually informed of how to access a lot of things. It's only if you inquired well into them or someone actually told you. The things actually were never put in front of you clearly to know about.
And you're also anxious about how many databases you're now sitting on with your personal medical information.
Well, obviously, prior to my knowledge of my diagnosis, I obviously was tested without my knowledge, so that's on a database. When the Skipton Fund got in touch with me initially, I obviously am on their database. Now I'm on some other government database. It's got to say, I don't know where it has been shared, and I think it's important that people actually know where their information is.
Those are the questions I have for you. Is there anything else you would like to say?
No, I think I've covered it, but there's just a couple of wee things I would like to just finish on. I would really like to thank Sir Brian and all the team. I have to say, from the people who phoned me, the people who regularly emailed me, I think the support that all the victims have been given has been absolutely fabulous. And thank you for giving myself and others a chance to share our journey, and that's what I'm calling it, a journey. I hope and pray as a victim and a survivor that answers are forthcoming on how, why, where patients like myself contracted the virus, and I hope in future that this situation never arises again. And the stigma of hepatitis C is understood by people generally, and I mean the general public have a clear understanding, and the medical profession does as well. And that also that people realise that this is about people. This is a human story. This is not about stats. This is a human story. Thank you very much.
Well, thank you for sharing your part of the human journey with us.
Okay, thank you.
Thank you. We'll take a break, shall we, till 3:10.
Thank you, sir.